Your Excellency, Mr. Sam Kutesa, President of the General Assembly, and Mr. Secretary-General, and Excellencies, ladies and gentlemen, I'd like to start my remarks by thanking you personally, Mr. President, for your commitment, your unfailing commitment to this really tricky issue, and thank you for convening this meeting today. Well, everybody, there are now 10 times fewer people diagnosed with Ebola each week than there were in September last year. And there really has been remarkable progress. Yet in preventing the final 10% of infections, about 120 or 30 per week, might be the hardest part of the response. And until this hard part, this last part, is completed, the affected nations and the world cannot declare victory. So I hope you will allow me to focus on 5 particular elements of what our President, the Secretary-General, and SRSG Ismail Ould Sheikh Ahmed covered in the remarks that they made. Firstly, this idea of commitment. Ismail affirmed that UNMIR is committed to getting to zero. And I can assure you that the broad coalition of governments and their response partners, together with the agencies, funds and programs of the United Nations system, are fully behind the declaration of the Mana River Union Summit last Sunday to end Ebola in 60 days. They will work hard to coordinate support for an intensive, country-led and community-driven push to end this outbreak within the period. And we are building on the hard work of last year. All the beds that were set up for Ebola treatment, all the burial teams that have been hard at work, all the behaviour change that's been initiated. And now what we need to do is to ensure that there is the needed capability in each of the 63 prefectures, counties and districts in an area that's almost as big as the country France. And what have they got to do? They've got to ensure strong surveillance of the population. They've got to identify people with Ebola, to confirm the diagnosis, to quickly arrange effective treatment, to identify the people that are their contacts, and to keep those people under review for 21 days. This is a really difficult task. It's like detective work, but it's detective work where you're having to find a very small number of people in a big population. And it's difficult because people move around a lot in this region, sometimes very long distances. But I want to stress to you that identifying and tracing the people who are contacts is absolutely vital, because the only place where this virus survives for any length of time is inside living people. So if we find and we monitor every person who is a contact, we can find and stop every chain of transmission, and the outbreak can be ended quickly and definitively. And so that's why our ambition is to ensure that all people who are newly diagnosed with Ebola are known contacts of others who have been confirmed to have the disease. But we're not there yet. In recent weeks, the percentage of new cases who are known contacts has sometimes been quite low, 20 or 30%. And under those circumstances, it's not surprising that there have been unexpected flare-ups of disease in places that were thought to be Ebola-free. Now, it's not easy tracing contacts, but it tends to be more effective when communities themselves are fully engaged in the effort and when they're working in harmony with the responders. And that's why there's been extra emphasis on trying to find ways to engage even the most reticent of communities, and to do it in ways that leads to building trust. There's actually no other way to do this. Now to my second point. The UN systems and other partners require additional finance to support the work of national governments as they strive to get to zero. Now, none of us really like to sit in front of you and to beg for resources. But I think I have to stress to you that the tasks that we're doing now are actually costly. And that's why money is needed. The cost was assessed in January, and we presented it in the latest Outlook of Needs and Requirements for the UN system and partners, a document that was released in January this year. And we, of course, are very eager to share the document with you and to tell you where it is on the web. Because what we're saying is that if the intensive effort is to be sustained and has to be sustained for much of this year, the total cost will be about 1.5 billion. Now, we've got some money in the bank. We've got about 600 million, but it does leave quite a large shortfall in finance. And the agencies, funds and programs of the UN system and our partners therefore have to ask you for more. Now, as the Secretary-General said, we're rather proud of one of the mechanisms for financing the response. That's the trust fund that he established in September last year. It moves money quickly to those who are in need. And since it was set up, it's received really generous contributions from 31 nations and also one private sector group. And it's distributed $131 million in strategic support for the response, going for logistical systems, for survivors, for orphans, for payment of workers, for treatment, and indeed for prevention. This week, we're going to show you how transparent the operations of this fund have been. We will publish a report of what's been done with all the contributions. We'll explain that 90% of the contributed funds have been distributed, and we are going to request further contributions from governments and organisations who've not yet contributed, as well as replenishments from those who've already done so. My third comment, Mr. President, is to say how the people and the governments of the affected countries are now reviving basic services. They're getting government working again. Schooling is restarting, as many of you will know, because it's been widely reported. As we've heard from people who've spoken already, healthcare is starting again, and markets are reopening. It's not easy, because to revive these services when you've got an outbreak of Ebola underway is a dangerous thing to do. It's not easy for doctors and nurses to work if they're anxious that their patients might have Ebola. And that's why we're working very hard on ensuring the safe revival of services. And international responders, especially from within Africa, and particularly through the African Union's Asawa initiative, are playing a vital role in this revival. And they continue to need strong support of member states. Our own United Nations Development Programme is convening a joint effort by the World Bank, the United Nations as a whole, the European Union, and the African Development Bank to support an Ebola recovery assessment. The UNDP Administrator, Helen Clark, is today in Freetown in Sierra Leone. And early this morning, she contacted me to send me the following 3 messages which I'd like to share with you. These are Helen's words. Stopping the outbreak continues to be top priority of the 3 governments and all partners. The last mile is never easy. The outbreak isn't over in all 3 countries isn't over in any one country until it's over in all 3 countries. While the situation in, for example, Sierra Leone is not what it was in September, October or November last year, nevertheless, it's still a major crisis because the deadly contagious disease is still moving around the country. Secondly, Helen says, big partnerships are needed to defeat the disease. Government leadership and international solidarity have been vital, but without community engagement and empowerment and behaviour change, the outbreak cannot be stopped. Community leaders and volunteers of all ages are playing a huge role. And Helen's third point, global solidarity for recovery is vital. To walk away when 0 cases has been achieved would be unconscionable. Essential services need to be rebuilt or built where they never existed. Livelihoods must be kick-started. The vulnerable, including widows, children, the elderly and the disabled, who've been so severely impacted, all need support. And the support will need to be sequenced from the short term to the medium and longer term, and should be framed in the context of national development plans. Now I go back to my 4th point. The UN mission for Ebola emergency response, as Ismail just said, will undergo a transition. Now, UNMIR was approved by this General Assembly in September as an innovative and short-term mechanism to deliver time-limited backup to the response. I've seen the real value that UNMIR is providing in support of national actions and in coordinating others who are involved in the response. I salute the leadership being provided by Ismail and his dedicated team. The UN contribution to the collective response will, though, progressively be transferred to the agency's funds and programs as they establish the capacity needed to help eliminate Ebola and revive basic services. A 5th point, Mr. President, you said that there will be a conference in Brussels on the 3rd of March. And this is going to be an important event to agree on the road to 0, to identify current gaps in the response, and to kickstart the recovery plan that Helen referred to. The conference will be co-chaired by the African Union, the presidents of Guinea, Liberia, Sierra Leone, and Togo, chair of ECOWAS. Also co-chairing is the European Union and the United Nations. This is going to be important, and it'll be followed by a meeting to focus on mobilizing resources for revival and recovery to be hosted here in New York by our United Nations Secretary General at the end of May. And they're going to be linked together, these conferences, and I hope that they will pave the way for adequate support. Mr. President, I conclude with 2 observations and 1 final thought. Number 1, as we've said before in this Assembly, the outbreak will not be over until the last case has been traced and treated. The UN system will remain fully and responsibly engaged until this outbreak is ended and through the period of recovery. Number 2, we know that there will be further outbreaks of hemorrhagic fever and other dangerous diseases in the future in many parts of our world. Throughout this response, our system is focusing on ways to apply lessons from the present outbreak so that nations and regions can respond more rapidly and effectively to future threats. And now to my last thought. The people of this region in Western Africa have endured enormous suffering as a result of this outbreak. Now, all of us, when we work, have people we look to alongside us, who we see as our guides. And in our case, it's the people of West Africa who are alongside us as we do our work. We feel them guiding us as to what we must do. We feel them checking that we do what we do right. We feel them urging us to do more so that this cruel tragedy is promptly brought to an end. Every day we recommit to serving them as best we can. And we thank you in this General Assembly for giving us the political support and the means to do this vital task. Thank you, Mr. President.